Ravensbrück concentration camp, 1942. The medical block. A doctor walks in, white coat, stethoscope round her neck, medical degree on the wall, and the prisoners scream. Not because they're ill, because they know what's coming. This doctor doesn't heal, she experiments. Without anesthesia, without consent, without mercy, she performs surgeries just to see what happens. Cuts open legs to test infection, breaks bones to study healing, removes organs to practice technique. And when prisoners beg, "Please give me something for the pain," she says, "Pain is part of the experiment." Her name was Dr. Herta Oberheuser, and she turned medicine into torture. This is her story. Herta Oberheuser, born 1911. Cologne, Germany, middle-class family, father an engineer, mother a housewife, ordinary childhood, but an intelligent girl, loved school, especially science, and decided young, "I'm going to be a doctor." In the 1930s, she entered medical school, University of Bonn. Back then, being a female doctor was hard, but Oberheuser succeeded, passed her exams, became a dermatologist, skin disease specialist, graduated in 1937, and took an oath, the Hippocratic Oath. First, do no harm. I'll protect patients, heal them, help them. But this oath became meaningless very quickly, because Oberheuser joined the Nazi Party, and everything changed. Medicine in Nazi Germany was different. Not just treatment, ideology, racial purity, genetic hygiene, eliminating the weak. These concepts were taught in medical schools, and Oberheuser believed it. Because Nazi ideology made sense to her. "We must use science to create a superior race," she said. And this science meant horrific things. Sterilize the disabled, euthanize the sick, and during war, experiment on prisoners, because they're worthless. Oberheuser joined this system, voluntarily. In 1940, she applied to the SS to be a doctor in a concentration camp, and was accepted. Her first posting, Ravensbrück. Ravensbrück, northern Germany, opened in 1939. Women's concentration camp. Thousands of women held there. Jews, political prisoners, social outcasts, all of them. And the camp had a medical block. But this wasn't a normal hospital, because two types of medicine were practiced here. First type, normal treatment, sometimes, rarely. Second type, experiments, often, systematic, horrific. In 1942, Oberheuser was posted there as camp doctor and immediately focused on the second type, experiments, because she saw it as contribution to science. But in reality, it was torture. Oberheuser's first major experiments involved sulfa drugs. Sulfa was antibiotic, treated infections, but the Nazi army wondered how effective for war wounds. To test it, they needed real wounds, real infections. So what did they do? Created wounds on prisoners, deliberately, cut their legs, then created infection, injected bacteria, rubbed in dirt, put glass fragments in, watched. Infection spread, pain started, fever rose, and then maybe gave sulfa, maybe didn't, whichever provided better scientific data. Oberheuser directed these experiments, personally performed surgery, and anesthesia, never used it. Why? To simulate real war conditions, she said. Why no anesthesia? Oberheuser's official answer: in war conditions, anesthesia might not be available. Must be realistic. But the real reason? She didn't see prisoners as human, inferior race, worthless. Anesthesia for them was wasteful, and perhaps pain also provided data. Body's response to stress, shock, blood pressure, pulse, all scientific observation. So whilst prisoners screamed, Oberheuser took notes. Calm, professional, like a scientist. But this wasn't science, it was torture. Systematic, planned, under medical disguise. Prisoners gave a name to the women subjected to these experiments: rabbits, because they were used like rabbits, laboratory animals. Most were Polish women, political prisoners, resistance members, and Oberheuser selected them. The young ones, the healthy ones, because they made good experimental subjects. One day you were called, come to the Revere. Medical block. You had hope, maybe treatment, maybe vitamins, maybe rest. But no, you were strapped to a table. Oberheuser arrived, white coat, stethoscope, and you understood what was coming. You screamed, you begged, please no. But she didn't care, took the scalpel, cut, and the pain began. No anesthesia, just pain, pure, unbearable pain. What was the procedure? Horrific. Oberheuser chose a section of the leg, cut deep to muscle tissue, then added infection source, bacteria, dirty cloth, glass fragments, wood shavings, everything, then stitched it, partially, because she wanted the infection to spread naturally, and waited. Days, sometimes weeks. The wound swelled, reddened, suppurated, stank. Fever rose, pain became unbearable, and Oberheuser came every day, checked, measured, photographed, took notes. But treatment? Sometimes, if experimental protocol required it. If it didn't, the wound worsened. Some women had their leg amputated. Some died, sepsis, blood poisoning. And Oberheuser moved to the next experiment. Infection experiments weren't enough. Oberheuser tried other things. Bone regeneration. How does it work? Break bone, watch, see how it heals. So what did she do? Broke prisoners' bones, deliberately, with hammer, surgically, sometimes remove bone fragments, completely. How does the body compensate for missing bone? She wondered, and watched. For months, women writhed in pain, couldn't walk, couldn't sleep, just pain, constant. And Oberheuser took notes. Day 15, no healing. Infection continuing. Subject complaining of pain. Subject, not human. Subject, an object, an experimental material. There were other experiments too. Nervous system, muscle tissue, organ transplant. Each one torture, each one without anesthesia. Oberheuser cut nerves. How was motor function affected? Removed muscles. Is regeneration possible? Transplanted organs, from one prisoner to another. Does the body reject? Each question meant another surgery, another scream, another trauma. And Oberheuser did these routinely. Every day, arrived in the morning, examined her patients. But they weren't patients, they were her victims. An examination wasn't treatment, it was torture. And then the most horrific part, children. Yes, there were children at Ravensbrück who came with their mothers or were born in the camp. And Oberheuser used them too, for experiments, because child physiology differs from adults. Scientific curiosity. So she also injected children, bacteria, virus, chemicals, watched how they responded. Some children died, quickly, some slowly, in pain. And their mothers watched helplessly, because they couldn't intervene. Oberheuser didn't care. Child, adult, didn't matter. All test subjects. How many surgeries? Exact number unknown, but estimates around 400. 400 times Oberheuser took the scalpel. 400 times she cut someone, without anesthesia. 400 times someone screamed, and she documented each one. Files, photographs, reports, just like a normal doctor. But normal doctors document to heal patients. Oberheuser, to torture. And these documents later became evidence at trial. Her own writings convicted her. Spring 1945. War ending, Soviet army approaching, Ravensbrück being evacuated. Oberheuser tried to escape, wore civilian clothes, changed identity. I'm just a doctor, didn't work in the camp, she said, but was caught. April 1945. By the Americans. At first they didn't understand who she was, but prisoners recognized her. Her, the one who did the experiments, the doctor. They pointed, and Oberheuser was arrested, initially denied it. I only treated them, did patient care. But there was evidence, files, witnesses, photographs, couldn't lie. and in 1946, she was sent to a special trial, the Nuremberg doctors' trial. Nuremberg, 1946 to 1947. The doctors' trial, 23 defendants, all doctors, all Nazis, all involved in experiments, and one woman, Herta Oberheuser, only female defendant. The courtroom was packed. Journalists, lawyers, survivors, everyone watching. And witnesses came. The rabbits, legs scarred, bones broken, survivors. They testified. Oberheuser operated on me, no anesthesia. I screamed, she didn't care. Another woman. She injected bacteria in my leg. It swelled, suppurated, suffered for months, still suffering. Photographs were shown of wounds, of surgeries. Horrific. The courtroom went silent. Oberheuser's defense? It was scientific research. To help the army? To save soldiers. Prosecutor asked, why without anesthesia? Oberheuser, to simulate realistic conditions. Prosecutor, and consent? Did you ask permission? Oberheuser, they were prisoners. Consent wasn't necessary. Prosecutor, what about the Hippocratic Oath? Oberheuser went silent because she had no answer. She'd sworn to first do no harm, but had caused harm 400 times, deliberately. And the for science excuse didn't work because real science requires consent, requires ethics, requires humanity. What Oberheuser did was just torture. 20 August 1947, verdict day. The judge stood. Herta Oberheuser, we find you guilty of crimes against humanity, of war crimes, of forcing participation in medical experiments. Sentence, 20 years imprisonment. Oberheuser showed no reaction, frozen. But survivors applauded, cried, because finally justice had come. But was it enough? 20 years for 400 tortures, about 18 days prison per torture. Mathematically, unjust. But that was the system, and at least she was convicted. Only woman, but convicted. Landsberg Prison, Bavaria, Germany. Oberheuser stayed there, but not 20 years. In 1952, just 5 years later, she was released. Why? The Cold War. West Germany was an ally now. Keeping Nazi criminals long-term was considered politically awkward, so they were pardoned. Many of them. Oberheuser too. And when she got out, what did she do? As if nothing had happened, returned to medicine. In 1958, in Stocksy, she opened her own clinic, hung a sign, Dr. Herta Oberheuser, family physician, and patients came, unknowing, brought their children, brought themselves, to a monster. 1958 Stocksy Clinic. Oberheuser a doctor again, but this time normal doctor, treated families, vaccinated children, wrote prescriptions for patients, and nobody knew. Her past, her war crimes, her tortures, because she was now Dr. Oberheuser. Respectable, trustworthy, white coat, stethoscope, just like before. But one difference. Now she used anesthesia. Now she relieved pain. Now she healed. Why? Because the Nazi system no longer existed. No more inferior races classification. Now patients were human. And Oberheuser changed because the system changed. Not from her own conscience, from the system. But in 1960, something happened. Ravensbrück survivors organized, the rabbits, and they learned. Oberheuser free, practicing medicine. They were furious. This woman tortured us. How can she be a doctor? They launched a campaign, went to the press. Oberheuser is a war criminal. Her license should be revoked. And the press took interest, became a scandal. News was broadcast, photographs, court documents, testimonies. The German public learned and reacted. This is unacceptable. The medical board came under pressure. In 1960, Oberheuser's license was revoked. She was no longer a doctor. Officially, but too late. She'd practiced for 12 years, seen hundreds of patients. Unknowing, Oberheuser became isolated, continued living in Stocksy, but no longer a doctor. Friends abandoned her. Neighbors avoided her. She was alone. Was she remorseful? We don't know. Never made a statement. Never apologized. Just lived quietly. Died in 1978. Age 67. Heart attack. Her funeral was small. Few people came. Headstone simple. Name, dates. Nothing else. Didn't say doctor, because she was no longer a doctor. Just a war criminal. Forgotten. But history didn't forget. Today we remember Oberheuser. Why? Because she's an example of what happens when medical ethics collapse. A reminder of how important the Hippocratic Oath is. Oberheuser was an educated doctor, intelligent, talented, but ideology turned her into a monster. For science, she said. For the army, she said. For the superior race, she said. And under all these excuses, she tortured people. Systematically, under medical disguise. And this shows us, education isn't enough. Intelligence isn't enough. Ethics are essential. Humanity is essential because medicine is one of the most powerful professions. Can heal or can destroy. Oberheuser chose the latter, and history never forgave her. 400 surgeries, 400 women, each one a name, each one a person, each one someone with families, hopes, dreams, and Oberheuser turned them into objects. Subject, test case, number, stole their humanity, ignored their pain, recorded their screams in the name of science. But this wasn't science, it was torture, and Oberheuser was eventually punished. But enough? No, only served 5 years. Then released, became a doctor again for 12 more years. And this is perhaps the most horrific part. Justice came, but came incomplete, came late, came insufficient, but still, history didn't forget her. We didn't forget, and we won't forget, because Oberheuser isn't just a monster. She's a warning about why medical ethics are vital, why first do no harm matters, and how ideology can turn good into evil. 400 women paid with their bodies. We must pay with our memory, by remembering, so it never happens again.